health alert that affects 1 in 8 women. Breast cancer can leave a woman with a feeling of loss, especially if they choose to have their breast tissue removed.
But doctors at Intermountain Medical Center are giving women their confidence back with new innovations in surgery. News 4 Utah's Saray Chin explains.
Restoring a woman's femininity can be daunting. How a woman wants to look after a mastectomy can be a beautiful choice thanks to doctors at Intermountain Medical Center revolutionizing breast reconstruction.
So I decided to have the double mastectomy.
Suzanne Worthland went in for a routine mammogram at age 41. What she learned stopped this avid marathon runner in her tracks.
It's a pretty large area of the breast that was cancerous, about 80% of the left side.
With family history and peace of mind, Suzanne decided on a double mastectomy. But breast reconstruction in the past left a lot to be desired.
But a lot of patients over the years would complain and say, you know, when I'm working out or when I'm picking up my kid or when I'm running a marathon and I'm using those muscles and they're contracting, the implant moves around and feels uncomfortable and looks strange.
That's because implants were placed behind the chest muscle. But breast reconstruction has come a long way with advanced tissue graft.
Some new products came out, new technology that allowed people to take donated skin and remove all of the cells from it so that you could have a product that's like a soft piece of leather. We now can use those products to create an internal bra around a breast implant.
Now the implants can be placed in front of the muscle, using cadaver skin to hold up the implant. Dr. John Hijawi at Intermountain Medical Center was one of the first few doctors in the country to use the advanced technique, well before it was considered the standard of care 10 years ago. Only recently has the method caught on.
When a woman has never had breast surgery, where is her breast? It's in front of her chest muscle. That's where the breast naturally lies.
Dr. John Hijawi says in 2015, only 5 to 10% of surgeons nationwide was using the pre-pectoral technique. In 2016, it was in the mid to high teens, and last year it was roughly 20 to 25%.
We're in a way more replacing like with like. We're putting things back where they belong, where they were before the mastectomy was done.
It's not only a more natural look and feel, but the technique cuts surgery time, reduces bleeding and pain, and oftentimes patients go home that same day.
I felt like I could get back to normal a lot quicker than if the implant was below the muscle.
Suzanne's normal was making sure she made it to the Boston Marathon several months later.
I think after the mastectomy, there's always a worry. You know, am I going to ever be normal again? Am I going to look okay? You know, my kids were kind of worried about it. How's mom going to be after? But, you know, it's amazing. I really felt like it's a blessing that we have plastic surgeons that can you know, make things look beautiful again and make things look whole. I'm hopeful that there are a lot of women out there that have great options, and it gets better and better every year.
Well, when someone texts you a picture of them finishing the Boston Marathon with their family all around them, I mean, that just says to you we're doing the right thing.
Suzanne has since run a couple more marathons after Boston. She credits her quality of life now to early detection from her mammogram and this reconstruction technique. Dr. Hijawi now teaches surgeons across the country the same method. In the newsroom, Saray Chin, News 4 Utah.